So that was one of the case studies that I presented yesterday as well. So in the clinical course, the first part was really presenting one end of the spectrum about metabolic comorbidities, which I went through earlier. On the complete other end is the malnutrition perspective, which Karen mentioned, the complications in MS. So all of those things, but respiratory muscle weakness, for example, increased rate of injury from falls, increased risk of micronutrient deficiencies are all really prevalent. And in MS, arguably are more heightened as something that should be avoided, or we try to avoid. So an example from my clinic, and this is something I presented yesterday, one of the patients, it was actually referred from that patient that I spoke about earlier. So they were good friends, and he had quite a lot of concerns about her weight and reducing, or her body composition change over time. So when that patient presented into clinic, she was just about 40 kilos, and her usual body weight is about 15 kilos heavier than that, or higher than that. And the patient, again, through our nutrition care process, we don't jump to food straight away. It's actually quite inappropriate at those time points. So getting a bit of a journey and story from that patient and building rapport is the first part of our whole encounter. And that patient described quite a awful situation, actually, about being told that she was allergic to sugar from a blood test result in 2001. So for the last 25 years, her eating pattern has completely changed in fear of what might happen if she has any form of sugar or carbohydrate. And something that a statement might come across as just a sweeping statement from a doctor at that point in time, people don't realize the detriment that that can have on someone's life. So for over 20 years, this person has lost over 70% of her total body weight and presented to clinic with a fear of, what do I eat? She had a history of juice cleansing from her MS. So on her diagnosis around that time in 2001, someone or a relative from her family had given her a book of different juice cleansers for different symptoms of MS. And one of her biggest symptoms was slow transit constipation, and no one had supported her from a bowel management perspective. So what else was she going to do than try things that were given to her from relatives and friends and things that she had found online? So from this juice cleansing, that was just washing her out, making it extremely difficult to gain weight. And from a dietary perspective, arguably that we're in the best position to support patients in that situation. So when she presented to clinic, she was mobilizing with 2 canes, and that was purely just fear of, if I was to have a fall, what would happen? Bones were protruding. She had muscle wasting and
Very deconditioned.
very deconditioned. So working closely with an exercise physiologist to promote strength and conditioning. From a dietary perspective, we talk about things like fortifying meals. So saying to a patient, have another main meal in a day is not realistic when they've got poor appetite, cognitive fatigue, they can't prepare their own meals, for example. So a strategy that we can use is fortifying foods, which is technically getting more bang for your buck. So adding in calories and protein to something that is already established in her diet. We also have a tool that we can prescribe, an oral nutrition support product. And there's so many out there at the moment, which I think is awesome for us.
Here it's Ensure.
Ensure, as an example. In Australia, we've got ones that, say, in a 300 ml bottle, it's nearly the size of a main meal in regards to calories or protein, if not more. So getting more bang for your buck in the sense of not having 500 snacks in a day, that is completely unrealistic, but adding in calories and protein to what is established. And again, we see these patients over a long period of time. So over about a 14-month change and education for this patient of how to live well with MS, how to restore body composition, lean body mass, gain fat mass, which is okay at 65 years old. If you're going to have a fall, it's actually a method of protection from bones.